Hi, great people. How are you and how have you been? Welcome back to our channel. My name is Dr. Ryan. Yes, and today I just want to continue the series that we began a few weeks ago about contraception, birth control, family planning, whichever way we want to call it. And actually, I'm bringing these things to you according to how people, are asking questions, and then I say instead of giving a response to one person, I can do it in a video, and everyone will be able to watch and benefit or even pass the information to their friends and their families, and yeah, basically that. So today I was talk about so many items, but then because of time, I'm just going to handle only oral contraception. That is the pills, the everyday pills, and maybe touch on something small about emergency contraception, still on the pill side, not on the IUCD side. So basically, I'll start with the progestin only, or what we call progesterone only pills. And these ones mainly, they contain progesterone, just like the hormone, progestin, which is like the hormone progesterone that is produced by the body. And basically, these ones are usually mainly used by mothers who are breastfeeding, or people in whom estrogen use is contraindicated. And I talked about this the other time. Estrogen might be contraindicated in people who usually have severe migrainous attacks, people who suffer from migraines, or people who have history or active deep venous thrombosis, or what we call DVT. So these people will not be using estrogen, and therefore they are advised to use the progestin only. So we have a few forms. Like if you are going to the market to look for them, I think we have microgynon, we have microlute. They are called mini pills. So if you just go to your shop, your pharmacy, and you ask for mini pills, if you think you're eligible for them, then they'll be able to give you this kind of contraception. So basically, that's it. And the mechanism of action for these hormonal pills, it's basically the same. Like even like the hormonal IUCDs. First of all, they'll inhibit ovulation, so you'll not be producing the female reproductive system will not be producing the the eggs. Again, they'll make the mucus at the cervix thick, so that the spermatozoa do not penetrate. And then again, they'll make the endometrial lining, or the uterine wall, very thin, and conducive for implantation. Just in case fertilization occurs, then the zygote will not be able to implant in the uterine wall. So the last in the mechanisms is, they also reduce the movement of the cilia, the beating action of the cilia in the fallopian tube, so that the ovum again will find it very difficult to meet the spermatozoa. So those are the mechanisms of action. And basically, when you talk about advantages of these mini pills, the progestin only, they're just the same as the other hormonal, methods of contraception, in that they reduce dysmenorrhea, that is pain during menstruation. They also reduce the amount of blood that is lost during menstruation, in what we usually call in medicine amenorrhagia. And also they reduce premenstrual symptoms. Those people who before their periods usually have mood disturbances or mood changes, so they usually reduce these symptoms, PMS. And again, upon withdrawal, or upon stopping taking them, your fertility comes back immediately. Unlike, I'll talk about the combined pills, which can take a few cycles for it to come back, your fertility to come back to normal. So that's about it. Those are the mini pills. Disadvantages, the normal things: nausea, vomiting. You might get uh, bleeding in between periods, and also amenorrhea that might be confused for pregnancy. But of course, it's not pregnancy because you're using them. It's just amenorrhea, secondary amenorrhea, due to using the pills. So those are some of the disadvantages. Headache will be there, nausea, abdominal discomfort, feeling fatigued, and bloating. So those are the things that you should be watching out for. And in case they are going beyond what you think it's normal, then you can seek help from your healthcare provider. So now I think we can go to the combined oral contraception, and this basically contains estrogen, the hormone estrogen, and progesterone in a synthetic form, very low doses, and these are pills that are, I forgot to say, for the microlute they are taken every day. They are 21 pills, so you take every day and then you break. Uh, Also, these ones, the combined oral contraception, which you'll find in the shops, in the pharmacies, is Yasmin, Femiplan. Many names are there for this pill. So they are taken again for 21 days, and then in the subsequent 7 days, you take a placebo that contains iron. I don't know whether it has a folic acid, but I know it's a placebo. It just has some iron, so it's not having the active hormones, progesterone and estrogen. So basically, um, these combined pills have also the same, almost the same mechanism of action, because I mean it's containing the progesterone that I just talked about, and it's containing now again estrogen. So it has a synergetic effect, a combined effect in terms of contraception. So actually, it's more effective than the progesterone only, and works again by inhibiting ovulation, making the hormones that usually regulate ovulation and follicular development. That is follicular stimulating hormone and luteinizing hormone not to go to their peaks, and that, of course, makes those. I mean, there's no follicle stimulation, so no follicular growth, and again, there's no ovulation. Also affects the cervical mucus, makes it very thick. Endometrial lining, the uterus, makes it very thin. So if you get the zygote being produced after fertilization, it cannot implant on the uterine wall, and again, reduces the motion of the cilia in the fallopian tubes, so that the ova doesn't finds it very difficult to meet the spermatozoa for fertilization. So basically, those are the mechanisms of action of the combined pills. And what else? What else do I want to talk about this in the mechanism? Nothing actually. So we go straight to the advantages, and these ones, the combined pills are usually known to regulate your menstrual cycles. If you're having irregular cycles, actually, even myself, I usually prescribe to my patients who are having irregular cycles these combined pills. If you are on another method of family planning, let's say like you have your coil, you have your implant, then you come to me with the irregular cycles. To make them regular, you can take these ones for a shorter duration of time. You can take combined pills, and these will give you your your cycles will become regular. But then again, when you're taking them as a primary your primary contraceptive method, again it makes them regular automatically. The other one is there's no, of course, there's no ovulation in this, so you'll not get metal schmerz. Metal schmerz is basically the pain that women in their reproductive ages get during ovulation. On that 14th day, on that day of your ovulation, whichever day that you ovulate, you usually get that pain and those changes in your body. So you'll not be getting these when you're using the combined oral contraception. The other one, of course, is um, the efficacy. Like I talked about the efficacy. It's more effective than the progesterone only pills. So again, there's something interesting about these combined oral contraception. You can manipulate your cycle. Like if you're supposed to have your periods maybe in a week, you can prolong the duration in which you take the pills, so that you delay your periods. Like I talked about them having 21 pills with active hormone, and 7 pills having the placebo. So these 7 pills, the 7 days, you can as well continue taking the pills, and for as long as you're taking the pill, again you'll not get your periods coming. So if you're having events, maybe you're attending a party somewhere, and you don't want to be uncomfortable having your periods, you can prolong the period that you take your pills so that you prevent your menstrual periods from starting on the date that they're supposed to start. So that's a very interesting one. And again, uh, these combined pills are also known to have a health benefit of lowering the risk of getting PID, that is the pelvic inflammatory disease, and also lowering the risk of getting some benign breast diseases like fibroadenomas, those fibrocystic changes mainly. So you'll be at a lower risk of getting those. So those are things that we should be looking out for. A very important point, there are ladies who are susceptible to getting ovarian cysts. So if you are on combined oral contraception, again, I talked about you not having your ovulation. So if you are not ovulating, you're not producing even, like your follicular stimulating hormone is shut down, then you're not going to be at risk of getting those functional ovarian cysts. So you are at a lower risk again of getting ovarian cysts, which is very important again. Not contraception related, but then it's important for you to note. Disadvantages are the same. You'll get your breasts being painful, you'll get a headache, you'll get your nausea, you'll get your bloating and abdominal discomfort. So these are the things that you should be watching out for. If they go again beyond what you expect, you're advised to seek help from your healthcare provider. Yeah, don't just stay and say no. I think it's normal. The other one is again, these ones do not protect you against, even the first ones do not protect you against getting sexually transmitted infections, STDs, and so you should be taking precaution, being faithful to your partners, practicing in like whatever we usually recommend you to do. And then again, these ones you have to take daily, just like the progesterone only, you have to take daily. So if you miss, again, there's a risk of you getting pregnant. So it's usually advised, actually a missed pill is a pill that is taken more than 3 hours from the time that you set for you to take everyday pill. So if you take it more than 3 hours, it's like a missed pill. And if you miss a pill, you should take it immediately that you remember that you missed it. You take it immediately and then continue with the normal day, time of the day that you usually take the pill. And then it's advised that during the 48 hours of missing the pill, you use a backup method. You can use the barrier methods, you can abstain, you can withdraw, but make sure that you use a backup method. So that's about it. And the other thing is that when you stop taking these combined oral pills, again, you might get your fertility returning later than the progesterone only. So you'll be having issues with, like maybe a month or 2 months. So it's not immediate like with the progestin only pills. Something I forgot on the advantages. So because you're not getting ovulation, of course you'll not get pregnant. So you are at a low risk of getting these ectopic pregnancies. So these are some of the things that you need to know. And as a doctor, again, there's what we call contraindications and indications. So basically, indications are for people who the healthcare provider has told them that they're eligible to take this form of family planning. But the contraindications for taking the combined pills, are people who have history or they have active stroke, people who have coronary artery disease, people having diabetes and it is affecting the blood vessels. No, it has vascular complications. People who have deep venous thrombosis, active or history of it, and people who have untreated hypertension or high blood pressure, and also people who have abnormal uterine bleeding. And of course, you have to confirm first before you start whether you're pregnant or not. So someone having a dysfunctional uterine bleeding, vaginal bleeding, or someone who is pregnant, of course, they cannot use these methods. Okay. So today I said, like we are going to take a few minutes. So like I'm going very fast, but I'm again not trying to. I'm trying to avoid not to miss anything. So last but not the least, it's the emergency contraception, and I'm only going to talk about only one type of a pill that contains the hormone, like the synthetic progesterone, and it contains a hormone called levonorgestrel in a dose of 0.75 two pills or 1.5 one pill. And again, just before I say anything about it, emergency contraception is not like it's not to be used like a routine method of family planning, because it comes with many risks, and one of them is ectopic pregnancies. Actually, emergency contraception rarely prevents you from getting ectopic pregnancy, because the mechanism is usually very local. It makes the it provides you with a high level of this hormone progesterone, but also doesn't protect you so much from getting ectopic pregnancies. So these pills, the emergency pills, usually protect you from getting pregnant. They more effectively within 72 hours, but then most people would say up to 120 hours. That is 5 days. So the efficacy usually goes reducing. Like if you take them within 24 hours, you are more safe than someone who takes them on the 120th hour. So basically these, and again, when you talk about side effects are usually the same, but for the progesterone only, these emergency contraception, because of the high dosage, they might come in stronger and more severe. In terms of the headache, nausea, uh, getting a disturbance in your cycle. So that's why we advise people not to use them as often. It's actually recommended maybe like 2 to 3 times in a year if you have to use them, because again, it's not a routine method of family planning. And like I said, to note is that they don't prevent. They rarely prevent you from getting ectopic pregnancies. Actually, that's one of the complications. When you talk about disadvantages, that's one of the disadvantages, getting ectopic pregnancies. And of course, that's lethal, because you might get your pregnancy rupturing and getting all the complications. So basically, these are the things. Progesterone only, which you can call it a mini pill. Progestin only, you can call it whichever name you want to call it. And taken daily is 21 days. And I talked about the advantages and disadvantages. Then the combined pills, those Yasmin and the Anteri 5 and Femiplan. Again, disadvantages and advantages. Taken daily, so you have to remember and take the pills. If you don't take, again, backup methods and taking the pills as soon as you remember to take them. So I'll be bringing more and more according to how the questions come. If you have any question, again, put it in the comment section. I'll be here to respond. And I think next time we'll be talking about something different. Maybe the implants. We can talk about Depo, medroxyprogesterone, and others, yes. So until next time, just give us your thoughts. And if you've not subscribed, again, I remind you, please subscribe to our channel, put on the bell, so that when we do videos, you are the first one to watch and give us feedback. Thank you so much. Be blessed.